Hello everyone, we are Group 4 and in this video, we're going to discuss about HIV or Human Immunodeficiency Virus. HIV or Human Immunodeficiency Virus is a virus that attacks the body's immune system, specifically targeting CD4 cells, also known as T cells, which are crucial for fighting off infections and diseases. HIV weakens the immune system over time, making it difficult for the body to fight off infections and diseases. If left untreated, HIV can progress to a more severe stage known as AIDS or acquired immunodeficiency syndrome, where the immune system is severely compromised and the body becomes susceptible to a range of opportunistic infections and cancers. Next is we have the risk factors. These risk factors increase the likelihood of acquiring HIV. First is we have the sexual partners. Engaging in sexual activity with multiple partners increases the risk of exposure to HIV, especially if unprotected sex is involved. Each additional sexual partner introduces the potential for exposure to the virus, particularly if any of the partners are HIV positive. Second is we have the bisexual partners. Having sexual partners who engage in bisexual behavior increases the risk of HIV transmission due to the potential for exposure to the virus through sexual contact. Bisexual individuals may have multiple partners from different sexual networks, which can heighten the risk of HIV transmission. And last is we have the intravenous drug use. Sharing needles or other equipment for injecting drugs increases the risk of HIV transmission through exposure to contaminated blood. Intravenous drugs who share needles are at a particularly high risk of acquiring HIV, as the virus can be present in blood and transmitted through needle sharing practices. Additionally, sexual activity associated with drug use can further increase the risk of HIV transmission.
The early stage of HIV infection is characterized by nonspecific symptoms that may resemble a flu-like illness. Common manifestations include: first, fatigue. Patients may experience persistent tiredness and lack of energy. Second is anemia, decreased red blood cell count leading to fatigue and weakness. Third, diarrhea, gastrointestinal disturbances including frequent loose stools. Fourth, weight loss, unintentional weight loss despite normal dietary intake. Fifth is like flu-like symptoms, fever, sore throat, swollen lymph nodes, and body aches resembling influenza. Higher risk of opportunistic infections. Individuals with HIV are at increased risk of developing infections such as toxoplasmosis and cytomegalovirus. Second is neurological involvement. HIV may invade the cerebrospinal fluid, leading to severe neurological complications. Third is tuberculosis. HIV-positive individuals have a heightened susceptibility to tuberculosis, a bacterial infection that primarily affects the lungs. Next is the disease progression of HIV. First is the initial invasion or acute phase. Mild flu-like symptoms occur due to the initial invasion of the virus. Seroconversion, the individual's transitions from HIV serum negative to HIV serum positive. Second is the asymptomatic period. Patients remain largely asymptomatic, but the virus continues to replicate. This lasts approximately 3 to 11 years. Symptoms such as weight loss and fatigue may persist. Third is the symptomatic period. This characterized by the presence of opportunistic infections and malignancies. CD4 count drops below 200 cells, indicating severe immunosuppression. Common opportunistic infections include toxoplasmosis, oral and vaginal candidiasis, gastrointestinal illness, herpes simplex, pneumocystis, carinine pneumonia, and Kaposi sarcoma.
Diagnostic tests. Number 1. ELISA, Enzyme Link Immunoassay, to detect antibodies in the blood. Number 2. Western blot analysis, to separate and identify proteins. A mixture is separated based on molecular weight. Mode of transmission: exposure to blood and body secretions through sexual contact. Sharing of contaminated needles for injection. Transfusion of contaminated blood. Breastfeeding. And lastly, multiple sexual partners.
Effects of HIV to pregnancy. HIV infection during pregnancy can lead to several adverse effects on both the mother and the baby. Here's how it affects pregnancy. Low birth weight. HIV-positive mothers are at higher risk of delivering babies with the low birth weight, which can lead to various health complications for the newborn. Preterm birth. There's an increased risk of preterm birth among pregnant women with HIV, meaning the baby is born before 37 weeks of gestation. Preterm birth can also lead to various health issues for the baby. Transmission of HIV to the baby. Without proper medical intervention, approximately 20 to 50% of infants born to HIV-positive mothers can contract HIV and develop AIDS. Within the first year of life, if left untreated, this transmission can occur during pregnancy, childbirth, or breastfeeding. These effects underscore the importance of early detection, proper medical care, and antiretroviral therapy during pregnancy to reduce the risk of transmission and improve outcomes for both the mother and the baby. Issues to be addressed when HIV positive. When someone is HIV positive, there are several critical issues that need to be addressed. Safer sex practice. It's essential for HIV positive individuals to practice safer sex to prevent the transmission of the virus to their partners. This includes consistent and correct use of condoms and, if possible, engaging in sexual activities with partners who are also aware of their HIV status and are taking preventive measures. Testing of sexual contacts. HIV-positive individuals should encourage their sexual partners to get tested for HIV regularly to ensure early detection and appropriate medical care if needed. Knowing the HIV status of sexual contacts allows for informed decision-making regarding sexual activities and reduces the risk of transmission. Continuation or termination of pregnancy. HIV-positive individuals who become pregnant face complex decision regarding their pregnancy. They need to consider the potential risk of transmitting the virus to the baby, the availability of medical interventions to reduce transmission risk, and the personal and the ethical considerations surrounding continuation or termination of the pregnancy. Counseling and support services are essential to help individuals make informed decisions that align with their values and health needs.
Therapeutic management for HIV. First, HIV-positive women are advised to avoid pregnancy. Women who are not on HIV treatment or have a detectable viral load can pass on HIV to their baby during pregnancy, birth, or breastfeeding, so it is advised to avoid pregnancy. Second, monitoring of the CD4 cell counts and viral load level. The goal of therapies is to maintain the CD4 cell count at greater than 500 cells per cubic millimeter by administering oral sidovudine plus one or more protease inhibitors such as ritonavir or Norvir or indinavir or Crivixan in conjunction with NRTI drugs or the nucleoside reverse transcriptase inhibitor drugs. Third, we have the medications. So in here, we have 3 medications to be used. Sidovudine, trimethoprim with sulfamethoxazole Bactrim or pentamidine pentam, and the sulfamethoxazole gantanol. So let's first dive into the sidovudine. It is administered to the woman beginning with the 14th week of pregnancy, and newborns receive antiviral therapy beginning with birth and a follow-up after 6 weeks. Next, the trimethoprim with sulfamethoxazole Bactrim or pentamidine pentam. These are administered to patients with pneumonia, and this can be teratogenic in early pregnancy. Then, last is the sulfamethoxazole gantanol, and this may lead to increase of bilirubin levels in newborn if it is administered in late pregnancy. Fourth is chemotherapy for those with Kaposi sarcoma or skin cancer in AIDS. This is contraindicated during early pregnancy because of potential for fetal injury but can be used later in pregnancy to halt the malignant growth. Fifth is CS delivery. This is to reduce the risk of mother-to-newborn transmission of HIV. Sixth, no amniocentesis. 7. No episiotomy. And 8. Use of standard infection precaution.
Risk for infection related to dysfunction of the immune system secondary to invasion of HIV. Administer acyclovir for herb simplex, clotrimazole troche for oral thrush, pyrimethamine and sulfadiazine for toxoplasmosis and trimethoprim for PCP. Immunization against pneumonia, influenza, and hepatitis B during labor, internal fetal, monitor scalp, blood sampling, forceps, and vacuum extraction are avoided to prevent bleeding. At birth, episiotomy and breastfeeding are avoided. Educated the patient about the mode of HIV transmission and safe sex practices. Use standard infection precaution to protect against the spread of the virus.